Legg-Calve-Perthes disease is avascular necrosis of the femoral head epiphysis due to disruption of its blood supply. Males are more likely to have this condition than females. When males have it, it's going to be seen anywhere between 2 and 14 years of age, whereas females, it's ages 3 to 12 years. This can be seen if someone has had a femoral neck fracture, they have had inflammatory conditions within the hip, or just an insidious onset of signs and symptoms. The signs and symptoms that we look for include a gradual onset of a limp and a mild hip or knee pain for several months. If you are working with this age group and they complain of pain in the groin, anterior thigh, or the knee that cannot be explained, this condition should be suspected. If it is not taken care of, the outcome is a shortened limb, anywhere from a 2 to 4 centimeter bilateral difference when looking at true leg length. The patient may also complain of anterior hip pain, and you may notice an abduction lurch during the stance phase of the gait, which indicates gluteus medius weakness. Range of motion for this condition is decreased, both active and passively, for hip extension, abduction, and external rotation. Special tests that we can perform include a longitudinal loading of the hip in the Faber position, as well as the log roll. In a log roll, you're moving only the femoral head in relation to the acetabulum and surrounding joint capsule. Comparing bilaterally helps you to see if there is more motion in one leg than the other. We are going to also test hip abductor weakness with a manual muscle test. Diagnosis is going to be through x-rays or a bone scan. Treatment is bed rest, because if it is not treated conservatively in this way, there will be complications such as the aforementioned limb length shortening, as well as the avascular necrosis of the femoral head.